The House will come to order. Reports from the Committee on Rules and Legislative Administration.
Winkler from the Committee on Rules and Legislative Administration, pursuant to Rules 1.21 and 3.33, designates the following bills to be placed on the calendar for the day for Thursday, May 16, 2019, and establishes a pre-filing requirement for amendments offered to the following bills. Senate file numbers 1753 and 322, House file number 359, and Senate file number 1618.
Calendar for the day. The first bill on the calendar for the day is Senate File 2313. The clerk will report the bill.
Senate file number 2313, number 1 on the calendar for the day, an act relating to insurance, the second engrossment.
The member from Hennepin, Representative Elkins, to-year bill.
Thank you, Madam Chair. This is a routine administrative housekeeping bill caring for the Department of Commerce. We're taking up the Senate language today. They passed this bill 63-0 a few days ago. The bill is divided into 5 articles. The first 4 relate to conformance with model language from the National Association of Insurance Commissioners. This is necessary. It's necessary for us to stay in conformance with the NAIC model ordinances in order to retain our credentialing for them. And this is important because it means that Minnesota-based insurance companies can rely on the examinations done by the Minnesota Department of Commerce to keep their licensing in other states as well. The 4th article, which deals with corporate governance, did have a data practices provision that engendered some conversation. And so for the record, the intent of the data practices language in Article 4, Section 5 of the bill applies to data as it is held by the Commerce Department. It does not preclude a third party from trying to obtain the data directly from an insurer through the normal legal process. The intent is solely to protect the data as it is held in the hands of the regulator. The 5th article of the bill relates to the Medicare Access Chip Reauthorization Act of 2015. This is a federal Medicare cleanup bill. One of the provisions in that bill prohibits insurance companies from offering Medicare plans that include a waiver of the deductible on Medicare Part B plans. So Medicare Part B covers the outpatient clinic, your doctor's office visits and the like if you're on Medicare. This is not a change that any of us would like to make, but it is required by federal law. And I know that Representative Gruenhagen would like to speak to this as well, because it does raise an issue about Minnesota is one of 3 so-called waiver states, which means that at the time Medicare was adopted, we had a robust regulatory framework for Medicare, and so we, Massachusetts and Wisconsin, were able to regulate Medicare at the state level, and that gave us some big advantages in terms of being able to offer the so-called cost plans, which were very popular, which are being phased out right now as part of a federal mandate. It's not something we chose to do. The same thing with this provision this year. It's not something that we chose to do, but it's required. We're doing it because if we didn't do this, our Medicare insurers would not be able to offer an important option that's available to them in the market right now. But it does raise a legitimate question about whether, because the feds keep clipping our wings, all of these things that we have been doing for our residents, because we were a waiver state, the feds keep taking them away, and so it does raise a legitimate question about whether we still want to be a waiver state anymore. But that's not a conversation that we need to have as part of this bill. So thank you.
There are no amendments at the desk. The clerk will give its bill its 3rd reading.
3rd reading, Senate file number 2313.
3rd reading. Discussion to the bill. Representative Gruenhagen.
Oh, thank you, Madam Speaker, and thank you, Representative Elkins, for bringing this forward. I would urge a green vote on this bill. I did have an amendment I decided not to offer. And Representative Elkins did hit on the subject of the whether that Minnesota is a waiver state. There's pros and cons to both that side, so I do believe this is a bipartisan concern or benefit, depending on, because we all have medical providers and it does affect them. According to CMS, which is published every year, Minnesota, because we're a waiver state, Minnesota seniors do not have the inpatient hospital care coverage floor of benefits available in 40 other states. That's one of the negatives about about being a waiver state. Now, there's also pro and con on premium. If you include those inpatient hospital benefits, your premiums are going to be higher. If you don't, of course, the premium's going to be lower. But I think, I've sold Medicare supplements since the 80s, so I've seen how this has progressed and how seniors have been given options in most cases where they pay more out of pocket, regardless of what the premium is. And there's I'm not going to make you an expert in Medicare supplements, okay? But there are 3 levels of Medicare supplements, basically, available in the state of Minnesota. First is the original Medicare supplement. That reimburses your medical providers at the highest reimbursement rate. It's called Original Medicare. That's available in the state of Minnesota. The second one is what Representative Elkins talked about. I call the Original Medicare kind of the Cadillac plan. Then you have the cost plan, okay, which, like Representative Elkins said, is being ended in many cases. This past year, we had over 300,000 seniors in the state of Minnesota that were canceled off that plan. And that cost plan, I call the Chevrolet plan. It reimburses very similar to Original Medicare, but it is not guaranteed renewable. The third level of Medicare supplements in the state is what's known as an Advantage plan. I call that the VW Beetle plan, okay? It reimburses doctors and hospitals at a lower rate than the cost plan or the Original Medicare. Now, why is that important? Because we know, if any of you read the Minneapolis Tribune article, The Race to Save Rural Hospitals, we know that the current reimbursement on Medicare is hospitals and doctors lose money. And so it's stressing our medical industry in the state of Minnesota. In fact, the article, if you read it, goes on to say there's 19 hospitals that are losing money in the state of Minnesota and are in danger of closing possibly. So what we have, members, is we have a situation where more and more seniors are being pushed onto these Advantage plans, which generally they have to pay more out of pocket, and your doctors and hospitals receive lower reimbursement. The other thing about the Advantage plan, it has in and out of hospital coverage, or in and out of network. So in other words, the cost plan and the senior and the Original Medicare, you can go anywhere in the state, and you can even go out of state in most cases and have complete coverage with your Medicare supplement. But when you go to the Advantage plan, you now, in most cases, most of those Advantage plans are in and out of network for your doctor and hospital, which means you're being micromanaged into the doctors and hospitals who will accept the lower reimbursement. And it gives much difficulty to seniors who spend time out of this state. Now, when we canceled the 300,000 out of the cost plan, I was fortunate enough to be in 2 counties that weren't canceled, but I still had about 60 seniors that got canceled in other counties. And let me tell you, even the ones in my counties that weren't canceled, there was a tremendous amount of angst with the seniors, not knowing what their benefits would be, whether they'd be covered at their current doctor and hospital. And to say that some of them had tears in their eyes when they came into my office is probably an understatement. So members, I think it's something on a bipartisan basis we should look at next session and find out the pros and cons of being a waiver state, which there's 3 other states, like Representative Elkins said, or if we should look at moving to being under the federal rules, which would give some additional benefits and also might take a few away, but and the premium would be higher. So I'm not completely convinced myself, but I think it's something with what's happening to the seniors in the state of Minnesota and our medical providers we should take a close look at. Thank you, Madam Speaker and members.
Seeing no further discussion, the clerk will take the roll. All those members wishing to vote, please vote. The clerk will close the roll. There being 126 ayes and 0 nays, the bill is passed and its title agreed to. Next on the calendar of the day is Senate File 998. The clerk will report the bill.
Senate File number 998, number 2 on the calendar for the day, an act relating to cities, the second engrossment.
The member from Hennepin, Representative Nelson, to your bill.
Thank you, Madam Speaker. Members, this is a fairly straightforward bill. When it started out, it was a little more controversial, but we worked with the cities and with the contractors that were interested in this, and we got it back to where there's kind of agreement on both sides. And what it does, it just sets up a simple mechanism where a permit applicant to the city, be it to do work, install antennas on a tower, or do building permits or building division. Anyway, they can request an estimate of the cost of consulting fees that the city will charge them later on in the process. So that way they have an idea going into it how much the cost is going to be. And that's all the bill does. It just says if the applicant wants to or asks the city that they have to provide an estimate. And then they can decide whether they're going to go forward or not. That's all the bill does. And members, I stand for your questions.
There are no amendments at the desk. The clerk will give its bill its third reading.
Third reading, Senate File number 998.
Third reading. Discussion to the bill. Representative Nelson.
It's a good bill. Vote yes.
Seeing no further discussion, the clerk will take the roll. The clerk will close the roll. There being 127 ayes and 0 nays, the bill is passed and its title agreed to. The next bill on the calendar for the day is Senate File 316. The clerk will report the bill.
Senate File number 316, number 3 on the calendar for the day, an act relating to state government, the second engrossment.
Member from Dakota, Representative Masin.
Thank you, Madam Speaker. Members, this bill is essentially a
Representative
response.
Masin, sir, my apologies for interrupting. Would you like to put the House language in before you present your bill?
That will be fine.
Wonderful. The clerk will report the amendment.
Masin moves to amend Senate File number 316, the second engrossment as follows. The amendment is coded DEA 132.
All those in favor of the amendment, please say aye. Aye. Those opposed, say nay. The amendment is adopted. Representative Masin, to your bill as amended.
Thank you, Madam Speaker. Members, what this amendment does is put the House language back into the bill, and I have talked with the Senate author about this. The House version is much more concise, and it does have the approval of all the stakeholders. And again, what this does is tries to eliminate some of the problems the state has had when some of the agencies have rolled out new software programs. And so in the future, no matter what, if it's they're implementing a new software program or a new functionality, it will be important that they have all the users that are going to be using the program tested ahead of time. So it's, again, it's a simple bill. I'd appreciate your support. Thank you.
No further amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File Number 316, as amended.
Third reading, Representative Lucero.
Thank you, Madam Speaker, and I'm wondering if the bill author would yield for 2 questions.
She will yield. Representative Lucero.
Thank you, Madam Speaker, and Representative Masin. So I can ask both questions at the same time. So the first question I have is, I see here that local unit of government does not include a school district. I'm just wondering if you could fill us in why there's an exclusion for school districts in this language. And then second, I see beginning on line 1.15, it gives the opportunity for a local unit of government to do the acceptance testing unless the testing is deemed not feasible or not necessary by the relevant agency commissioner. So my second question, Madam Speaker and Representative Masin, is would the local unit of government, would they be able to reject it, or does the language here of the amendment simply allow for user acceptance testing, but they would still have to adopt whatever the software is, where they don't have the ability to outright reject it if they chose it wasn't a good fit? Thank you.
Representative Masin.
Madam Chair, Representative, the first question having to do with the schools district, again, it seems to be a separate entity, and in the original bill is one that actually is in the Senate language. It includes the universities, and they too are not part of the normal systems. And as far as the other question, again, it does allow for some flexibility. So that, hopefully that answers your question.
Representative Lucero.
Thank you, Madam Speaker. It doesn't answer the question, but I won't press you here on the floor. I'll maybe have a conversation offline. But it really comes down to, would the local unit of government be able to reject a software, not just simply test a software prior to it potentially being mandated upon them? That's what my question is trying to get at. So thank you.
Representative Nash.
Well, thank you, Madam Speaker. Members, I think that this bill has a lot of very good things, and Representative Masin, you and I have talked about it. I do support this. I do agree with Representative Lucero that there are probably some things that need to be addressed relative to a school district and their ability to refuse a piece of software. Because, members, here's the important part and the most salient detail of this software testing is this would have prevented MNLARS. This would have prevented MNsure. This would have stopped METS as it was stopped, because when you put the software in the hands of the end user, you're essentially encouraging them to break it. You want them to expose the weaknesses of the software, and we've gone through 2 years of hell for our deputy registrars. They would have been able to expose some of the weaknesses of the software that we produce, and we're going to make software. Software will be deployed. We've talked about a new piece of software that's likely to be rolled out in a couple of years, 18 months, 16 months, somewhere there. I think this is critical because we need to put it in the hands of the people that are going to be using it on a daily basis and encourage them to find every possible way they can to break it, because as those of us in the IT industry on our side and on your side know that that's where the fixes need to happen before it gets rolled out. So I do support this. I'm pretty sure it's going to be going to conference committee. You can tell me later. I would hope that if we do, I'd love to be a part of that. But I think that this is an important piece and a good step in the right direction, so I would encourage members to vote green.
Representative Jurgens.
Thank you, Madam Speaker. Would the author yield for one question, please?
She will yield. Representative Jurgens.
Thank you, Madam Speaker. And Representative Masin, if this is passed off the House and the Senate and signed by the governor, you mentioned that it would address new software. Does that include periodic data matching as new software? Or since that's already in the works, would that not be covered under this?
Representative Masin.
Thank you, Madam Speaker and Representative. The interpretation that I have is if there's anything, there's a major change to the way the program operates, it would fall under the restrictions or the qualifications here. But otherwise, just upgrades, et cetera, no, it would not.
Okay,
Representative
thank you.
Jurgens. Representative Elkins.
Thank you, Madam Chair. To Representative Lucero's earlier question, the original draft of the bill included MnSCU, for example, but we removed it in the amended language because this deals with things that Minute supervises, and MnSCU and school districts really aren't under Minute's purview. So that's the reason why the school stuff was taken out. And then in terms of the second question about can a user reject the change, it's called user acceptance testing for a reason. If the users don't accept it, then it doesn't pass, and you go back and you fix it. So that's implied in the term. And in truth, you know, it's kind of sad that we have to start writing this kind of stuff into law because it should go without saying. But here we are, and we've got a bill that all of the local government stakeholders and MNIT were found acceptable and workable. So I urge a green vote on that. And then to Representative Nash's point, I'd like to point out that this would not have prevented MNLARS because there was user acceptance testing for MNLARS. The failure really there was that the deputy registrars weren't engaged. DPS was underfunded, did an ineffective job of reaching out to the deputy registrars and getting them to actually do the testing that they had the opportunity to do, and so hardly any of them did it. And that's really what the problem was on MNLARS.
Representative Lucero.
Thank you, Madam Speaker, and to Representative Elkins' point there. The reason I was asking the second question regarding the rejection is because the language as written, it's silent on that. And I'm thinking, and by the way, I think this is moving in a good direction, moving us in the right direction, so I'm not opposed to the language. But because it is silent, I think back on the MNLARS, as Representative Nash just spoke. Imagine the deputy registrars across the state, and if a handful of them, through the course of their testing, decided to reject it. We don't want to implement this new software, right? They're really not going to have a choice if the state is moving to a new software. Some of them can't just outright reject it where others do. So that's where I'm getting at with the question. So it's kind of a gray area, the language as written. So thank you.
Representative Elkins.
Really quick, that is a fair point because during the MNLARS testing there were objections raised by deputy registrars, and they were told that the things that they were identified would have to be implemented after the go live as part of enhancement. So that's a fair point. Thanks.
Representative Torkelson.
Well, thank you. Not to belabor this any more than it's been belabored already, but I have to set the record straight. Both the deputy registrars and the car dealers came to me before MNLARS rolled out and said, we think there's going to be trouble. We think this system is not ready for prime time, and we as a legislature and an administration decided to go ahead anyway. Sometimes we just need to listen. Thank you, Madam Speaker.
Representative Nash.
Well, thank you, Madam Speaker. I just ran from the balcony where some of my constituents were sitting, and I heard Representative Elkins talk about what Chair Torkelson just did. And had we had testing where they had to check off and they would have said, yes, this works, or hey, no, this doesn't work, it would have been prevented, Representative Elkins. So, members, if we require this testing before it walks out the door and goes into production, that's what we're going to get, and it would have exposed in an official capacity and would have said, hey, this doesn't work. And instead, what we've gotten is 2 years of folks suffering because we didn't go down the road of doing due diligence and making sure that the software that we required of them to use to be user acceptance tested. It's pretty standard stuff, and Representative Elkins, I vehemently disagree with you. If this would have been done, if we would have required a checkoff, if we would have required them to do this before it went live, it would have prevented it. So thank you, Madam Speaker and members.
Representative Bonner.
Thank you, Madam Chair, members. Just to be clear, that user acceptance testing is a standard practice in the world of software development, and in fact, this is always what should be intended. The real intent behind this bill is to make sure that not only are we doing that testing, but that we're making sure that we have a full complement of the individual stakeholders that are impacted. So that when we get to the place where we're able to make what's often referred to as a go, no-go decision on whether or not to move forward with a rollout, that we have good information, we can make good decisions on how to do that. In this case, we will say that there was user acceptance testing. Unfortunately, we did not have all the stakeholders at the table. So this bill is really intended to help make sure that that does not happen again and that we are able to make good decisions moving forward. I urge a green vote on this.
Representative Masin.
Thank you, Madam Speaker. We are very fortunate in this body to have a number of talented, both staff and members in the IT field, and I can tell you that there was a lot of effort put into this final product. So I truly urge a green vote here. And just to repeat what Representative Bonner said, essentially what we have here is best practices, but what we are now doing is making it official so that we do not have another instance of MNLARS, and there was a meeting on that this morning, as a matter of fact. So this will make sure that everybody knows that they do have to have the extensive testing. And again, I'd appreciate a green vote.
Seeing no further discussion, the clerk will take the roll. The clerk will close the roll. With 128 ayes and 0 nays, the bill is passed as amended and its title agreed to. The next bill on the calendar for the day is Senate File 955. The clerk will report the bill.
Senate File number 955, number 5 on the calendar for the day, an act relating to health, the second engrossment.
The member from Scott, Representative Albright, to your bill.
Thank you, Madam Speaker. Senate File 955 is an agency bill that makes 2 corrections to law. The first was to provide for portability of licensure for 5 years. Currently under law, if you are in a health perspective licensure and you want to practice in the state of Minnesota, you have to go through some additional steps. That's redundant, and the agency is requesting that with certain prescriptive requirements that we allow for that to happen when the licensure is over 5 years from another state. Secondly, and most importantly, it also requires health professionals with a duty to inform, particularly when they are in consultation with a patient and they are aware of circumstances that would promote or provoke an opportunity for that patient to do harm to someone else. This is the Senate file came over with unanimous vote, and I would urge a green vote. Thank you, members.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File number 955.
Third reading, discussion. Seeing no discussion, the clerk will take the roll. The clerk will close the roll. With 126 ayes and 0 nays, the bill is passed and its title agreed to. Motions and resolutions. There are no motions and resolutions. Announcements. Representative Kunish-Podine.
Thank you, Madam Chair and members. About a week ago, we had 3 visitors from the Sami indigenous folks. They were on their way to Standing Rock, wanted to stop in Minnesota to acknowledge the Norwegian, Swedish, Finnish, and Russian ancestry here in Minnesota. But they also came to remind me about and remind us that 2019 is the International Year of Indigenous Languages. And so, members, I have a House resolution here. I'd like to just read you a little bit of it. I won't read the whole thing. But it starts out as, whereas languages play a crucial role in our daily lives, not only as a medium of communication, education, and social interaction, but it's also the heart of each individual's unique identity, culture, history, and memory. And of the world's estimated 6,700 languages, roughly 40% are in danger of disappearing. The majority of those belong to indigenous people. So those gentlemen that were here from the Sami Nation consider themselves indigenous folks, and they themselves work really hard on preserving and rebuilding their native language. So today, I would like to read this resolution. Whereas the Dakota and Ojibwe languages are the official indigenous languages in Minnesota, be it resolved by the Committee on Rules and Legislative Administration of the House of Representatives of the state of Minnesota, it commemorates 2019 as the International Year of Indigenous Languages and commends the work of those helping to preserve indigenous languages around the world. And so to all of you, I want to say Wopalatonka and Chimigwich.
Representative Winkler.
Madam Speaker, I move that when the House adjourns today, it adjourns until 10 a.m. Wednesday, May 15th, 2019.
Representative Winkler moves that when the House adjourns today, it adjourns until 10 a.m. Wednesday, May 15, 2019. All those in favor say aye. All those opposed say no. The motion prevails. Representative Winkler.
Madam Speaker, I move that the House do now adjourn.
Representative Winkler moves that the House do now adjourn. All those in favor say aye. Aye. Those opposed, no. The motion prevails and the House stands adjourned until 10 a.m. Wednesday, May 15th.